Which type of atrial septal defect is the most common, accounting for approximately 75% of cases? A. Ostium primum. B. Ostium secundum. C. Sinus venosus. D. Coronary sinus. Answer: B. Ostium secundum. A fixed split-second heart sound, S2, is a hallmark physical finding of ASD. What causes this phenomenon? A. Early closure of the aortic valve. B. Delayed closure of the tricuspid valve. C. Equalization of respiratory pressure changes between the atria. D. Severe pulmonary hypertension. Answer: C. Equalization of respiratory pressure changes between the atria. Which type of ASD is frequently associated with Down syndrome and often involves clefts in the mitral valve? A. Ostium secundum. B. Sinus venosus. C. Ostium primum. D. Patent foramen ovale, PFO. Answer: C. Ostium primum. What is the characteristic murmur heard in a patient with a large ASD? A. Holosystolic murmur at the apex. B. Midsystolic ejection murmur at the left upper sternal border. C. Diastolic decrescendo murmur at the left lower sternal border. D. Continuous machinery murmur. Answer: B. Midsystolic ejection murmur at the left upper sternal border, due to increased flow across the pulmonary valve. In a patient with an unrepaired ASD, the development of right-to-left shunting due to pulmonary hypertension is known as A. Holt-Oram syndrome. B. Eisenmenger syndrome. C. Ludenbacher syndrome. D. Dressler syndrome. Answer: B. Eisenmenger syndrome. Which ECG finding is most commonly associated with an ostium secundum ASD? A. Left axis deviation. B. Left bundle branch block. C. Right axis deviation and RSR pattern in V1. D. Prolonged QT interval. Answer: C. Right axis deviation and RSR pattern in V1. Ludenbacher syndrome is defined as the combination of an atrial septal defect and which other condition? A. Mitral stenosis. B. Aortic regurgitation. C. Coarctation of the aorta. D. Pulmonary stenosis. Answer: A. Mitral stenosis. Which imaging modality is considered the gold standard for the initial diagnosis and characterization of an ASD? A. Chest X-ray. B. Cardiac catheterization. C. Transthoracic echocardiography, TTE. D. Exercise stress test. Answer: C. Transthoracic echocardiography, TTE. Sinus venosus ASDs are most commonly associated with which other congenital anomaly? A. Transposition of the great arteries. B. Partial anomalous pulmonary venous return, PAPVR. C. Ventricular septal defect. D. Bicuspid aortic valve. Answer: B. Partial anomalous pulmonary venous return, PAPVR. What is the primary hemodynamic consequence of a significant left-to-right shunt in ASD? A. Left ventricular pressure overload. B. Right atrial and right ventricular volume overload. C. Systemic hypotension. D. Decreased pulmonary blood flow. Answer: B. Right atrial and right ventricular volume overload. Paradoxical embolism is a potential complication of ASD. Where does the embolus typically originate? A. Left atrium. B. Left ventricle. C. Systemic venous circulation, e.g., deep vein thrombosis. D. Pulmonary veins. Answer: C. Systemic venous circulation. At what age is elective closure of a significant, asymptomatic ASD usually recommended? A. Infancy, under 6 months. B. Preschool age, 2 to 4 years. C. Adolescence, 12 to 15 years. D. Only if symptoms develop in adulthood. Answer: B. Preschool age, 2 to 4 years. Which of the following is an absolute contraindication for the surgical or percutaneous closure of an ASD? A. History of atrial fibrillation. B. Right-to-left shunting with severe, irreversible pulmonary vascular resistance. C. Recurrent respiratory infections. D. Mild right ventricular enlargement. Answer: B. Right-to-left shunting with severe, irreversible pulmonary vascular resistance. Holt-Oram syndrome is a genetic condition characterized by ASD and A. Lower limb deformities, B. Polycystic kidney disease, C. Upper limb/thumb deformities, D. Cataracts. Answer: C. Upper limb/thumb deformities. On a chest X-ray, which of the following is a common sign of a large ASD? A. Small boot-shaped heart, B. Rib notching, C. Increased pulmonary vascular markings and prominent pulmonary artery segment, D. Massive left atrial enlargement. Answer: C. Increased pulmonary vascular markings and prominent pulmonary artery segment.